All right. I need Tosh to help me stop the video. Tosh, wherever you are, come back, please. All right. Those videos, I hope you like the videos that we selected this month. That video with the little girl talking about not eating animals, that's gone viral the past few weeks. I don't know if you've seen it online, but it's pretty amazing. And just a note, I went vegan for the animals, and the animals are what keeps me vegan. But I know that if, and especially related to our topic this month, if I'm not healthy, then I can't be a voice for the voiceless. So being an ethical vegan, I know it's important to be healthy as well. So tonight, I'm very excited to introduce our guest speaker, Dr. Bandana Chawla. And let me just go over some of her amazing qualifications. She's board certified in internal medicine. She graduated with honors from the University of Texas Southwestern Medical Center up in Dallas. She's listed on VegDocs and also on PCRM, and both she and her husband Munish are listed on plantbaseddoctors.org. If you haven't seen that site, check out plantbaseddoctors.org. Dr. Chawla is trilingual. She's also a mom of 2. She's in private practice, and she serves as the Associate Director of the Good Shepherd Hospice right here in Houston. She's also one of our volunteers. She and I have been doing outreach before at an outreach table, and tonight her presentation is called Be Well. So please let's give a warm welcome for Dr. Chawla. Tosh.
You guys hear me? Yes. All right. So I'm Dr. Chawla. Today I'll speak to you about my journey to veganism and then about my journey to becoming a plant-based physician. But mostly I'll share with you a few health tips that I give my patients as a plant-based physician. All right. So I won't waste too much time on this. Kristen's already covered it. I went to SMU for undergrad, where biology was my major, and medical anthropology was my minor. Stayed in Dallas for medical school, and then moved to Houston for residency, and I've been here since. How I became a vegan. You hear about patients eating healthier because their doctor had a talk with them. In my case, I became a vegan because my patients had a talk with me. So end of 2012, I just happened to have several patients come in a matter of a couple of weeks who had recently become vegan. And I started asking them their reasons. 3 that I remember well are a young pharmacy student who had actually gotten off her Advair inhaler, her single-layer oral medications for asthma, and her spirometry numbers, pulmonary function tests, were actually better than when she was on asthma medicine. She's the one who actually told me about the link between dairy and nasal allergies and asthma. Another young lady, and I still remember her quote, she said she has no problem with people hunting, but she had a huge issue with factory farming. I had never heard of the word factory farming. I did have an issue with people hunting. I was a vegetarian at the time. So I looked that up and found out what actually happens in factory farms. And the 3rd lady was a vegetarian lady in her 60s who had recently become a vegan because her 30-year-old son had told her about the violence in dairy industry. So again, here I am Googling about dairy industry and finding out what goes on. I became vegan along with my husband on February 1st, 2013 for ethical reasons. I spent a long time on this slide talking about these patients because of something called mere exposure effect. Mere exposure effect is a psychological phenomenon by which people tend to develop a preference for things merely because they're exposed to them repeatedly. These patients were my exposures to veganism that caused me to pause, research, and reflect. I want to encourage all of you to be one of those exposures for your own doctors. Go tell them that you're vegan now and that you want your cholesterol checked to see if the numbers are better. Or that you want your B12 level checked, or your vitamin D level checked to make sure that your supplemental dose that you're taking is correct for you. You never know, you might cause your doctor to go vegan. So for the first 2 years, I was pretty much a closet vegan. Did not really change my medical practice because I wasn't fully aware of the health benefits of a plant-based diet. Then I came across Physicians Committee for Responsible Medicine. It was a great feeling to know that there were vegan doctors out there and that they were actually promoting this diet and actually improving the health of their patients with this diet. So I went on their website, did a few courses, and started learning about the health benefits of a plant-based diet. Then, exactly 3 years after becoming a vegan, so in February of 2016 now, I met Dr. Neil Barnard, the founder and president of PCRM, in person. And that inspired me to start encouraging better diet in my patients, inspired me to put my name on the plant-based doctor's website, and really become serious in terms of being a plant-based doctor. So, as you can see from the PCRM new food plate, there is no meat, dairy, or eggs in these food groups. We recommend that the half the plate be fruits and vegetables, a quarter grains, whole grains, which we'll talk about later, and quarter protein, plant protein. So, now in my office, I have this on one of the walls. Let food be thy medicine, and medicine be thy food. And I want to point out to you who the author is. That's Hippocrates who said that. He's the father of Western medicine. All physicians are required to take the Hippocratic Oath at the graduation from medical school, to first do no harm. Perhaps we should also pay attention to other words of wisdom by Hippocrates, like the statement, though this was said 2,500 years ago, it is just as applicable today in our attempts to foster good health. So what is health? Let's look at the definition by World Health Organization. Health is the state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. So our goal should not just be absence of disease, but also the presence of health and well-being. This well-being can be achieved by actively making choices to promote our health and prevent disease, something we call preventive medicine. So no, we were not taught in medical school that preventive medicine kills on our first day, kills return business. But we weren't taught very much at all about preventive medicine. A few things like tetanus shots should be given every 10 years, mammogram should start at age 40, colonoscopy at age 50. But in general, we don't learn, and hence we don't teach much about the importance of diet in disease prevention. There is evidence that just getting 4 things right can reduce the risk of all chronic diseases by 80%. These 4 things are not smoking, maintaining a healthy weight, being active, and eating well. How do we eat well? Well, we can start with moving away from standard American diet, also appropriately called the SAD diet. As you can see, only 12% is what we would call healthy foods, 25% is animal foods, and 63% is oils, fats, fast food, processed and refined foods, and sweets. So basically, junk food is 63% of our diet as Americans. Now, let me contrast this to a vegan diet and then to whole food plant-based diet. So a vegan diet takes away this blue slice of the pie, which is great because that takes away your risk of several things that we're going to talk about later on. However, it doesn't tell you what your distribution of this and this should be. So there are plenty of vegans who are still not getting the recommended fiber. We're still not getting the recommended nutrients from fruits and vegetables. And I hate to say this, even though So Delicious is so awesome, but a lot of what we're eating, and more now, because now, I became a vegan 3.5 years ago, and some of you way before that. There weren't as many vegan donuts and cookies and pies that there are now. So we have a lot more vegan junk food to choose from. So it really, so let me tell you what the distribution should be according to whole food plant-based diet. Whole food plant-based diet wants that green part to be 90 to 95%, and the red part to be 5 to 10% of our calories, of our caloric intake in a day. So yeah, you don't have to take this away all the way. That's very difficult to do, but we do need to really reduce it quite a bit. We need to eat more of whole food plant-based stuff. So whole food just means that that's how food is in its whole, unrefined, unprocessed form, how it's found in nature. Legumes category is beans, chickpeas, peas, lentils, seeds, all of that stuff. Whole grains, I want to discuss because a lot of us are not getting whole grains, we're getting refined grains. Whole grains are complex carbohydrates with fiber, as opposed to the refined grains, which are simple carbohydrates. So whole grains have all three parts, the bran, the germ, and the endosperm. So refining removes the bran and the germ, leaving only the endosperm in the refined grains that we eat. So with the bran gone, almost all the fiber is lost. With the germ gone, about 25% of the grain's protein is lost, along with many key nutrients like iron, B vitamins, magnesium, and selenium. So when you hear about these enriched flours, that means that the whole grains have been refined to a flour, and a little bit of iron's put in, calling it enriched. So we recommend eating grains in their whole food form, and not their refined and processed forms. So now let's talk about what eating whole foods provides us. Well, one of the things it provides us is phytonutrients. Phytonutrients are substances found in plants that help protect the plants from environmental threats. And when we ingest them, they are beneficial to our health and prevent various diseases. There are more than 25,000 phytonutrients found in plant foods. We'll just go over 5 of them today. We'll pick one from each color. Lycopene helps reduce the risk of cancer, especially prostate cancer. So you men out there, start eating more of those tomatoes. Resveratrol is a powerful antioxidant found not just in red wine, but also in red grapes, grape juice, and most fruits and veggies in that color category. Lutein supports eye health by providing protection from cataracts and age-related macular degeneration. And you can get that in the greens. Glucosinolates are found in the high odorous vegetables, such as cabbage, cauliflower, onion, garlic, mushrooms. Those have high anti-cancer properties when cooked. Beta-carotene is a precursor of vitamin A. This phytonutrient helps maintain skin and eye health. New studies show a link between beta-carotene and breast cancer prevention. So just eating 3 to 6 milligrams of beta-carotene each day reduces the risk of breast cancer. And you can get beta-carotene from many sources besides just carrots. Few examples are sweet potatoes, squash, pumpkin, apricots, mangoes. Okay, so we know eating vegetables helps reduce our risk of cancer. But do we really have to avoid meat to reduce our risk? And the answer is yes. During processing or cooking of meat, heterocyclic amines and polycyclic aromatic hydrocarbons are formed. Both are mutagenic compounds. Mutagenic means they cause change in DNA that can increase the risk of cancer. Also, we know there are several cancers that are related to obesity. And as the obesity decreases on a plant-based diet, so does the risk of those cancers. We also know there are certain cancers that are associated with hormones in our meat and dairy. And as we decrease the intake of those hormones, we decrease our risk of breast, ovary, uterus, and prostate cancers. The China study. A lot of you already are familiar with the China study. If you've never heard of the China study, I highly recommend going home tonight and Googling the China study. China study is considered one of the most comprehensive studies of nutrition ever conducted. Data presented in the China study comes from Dr. T. Colin Campbell's part in a 20-year study that was done in cooperation between Cornell University, Oxford University, and the Chinese Academy of Preventive Medicine. China study included 65 counties in China and 6,500 adults. Main conclusion was that animal protein in meat and dairy promotes the growth of cancer. Researchers discovered that they could actually turn the growth of cancer cells on and off by raising and lowering doses of casein. Casein is the protein found in milk. In October of 2015, less than a year ago, World Health Organization finally announced the link between red meat and colorectal cancer. And we'll look at that a bit. So processed red meats got placed in Group 1 carcinogen category. Some of the examples of other Group 1 carcinogens are tobacco smoking and asbestos exposure. So the same category as smoking. The non-processed red meats got put in the lower category, Group 2A, as probably causes cancer. So processed red meats causes cancer. So we know that red meats causes colorectal cancer. What can prevent it? Fiber. Fiber greatly speeds the passage of food through the colon, effectively removing carcinogens. We know that countries where people have 1 to 2 bowel movements every day don't see any colon cancer. Whereas America, where the average is every 2 to 3 days for an average American, has a much higher rate of colon cancer. USDA recommends that we eat 25 to 30 grams of fiber from food, not supplements.
That's right.
Currently, dietary fiber intake among adults in the United States is 15 grams a day. As plant-based doctors, we recommend 40 grams of fiber a day. So besides removing carcinogens, it also helps keep us full, so we maintain a healthy body weight. Also gets rid of estrogen, so it decreases the risk of those cancers associated with that. Lowers cholesterol, helps control blood sugar levels, and just a reminder that there is no fiber in any animal product. So how can we get the recommended amount of fiber in our diet? By eating plants, and only plants. Opportunity cost is loss of potential gain from other alternatives when one alternative is chosen. So we can only eat a certain number of calories a day. Well, actually, I'll rephrase that. We should only eat a certain number of calories a day. And if those get taken up by animal products, we cannot get them from whole food plants. And those are the things that have antioxidants, vitamins, minerals, fiber, and phytonutrients that we talked about. If we want to try to meet the PCRM recommendations, there really isn't any room to put in any animal foods in there. So we've talked quite a bit about the number 2 killer of Americans. Let's move on to the number 1 killer, heart disease. Leading cause of morbidity and mortality in USA is heart disease. Though current pills, stents, bypass surgeries manage coronary artery disease, they do little to prevent or stop it. Dr. Caldwell Esselstyn's 20-year study showed that nutritional intervention halts and even reverses coronary artery disease. In fact, his patients in his group had better outcomes long-term than control groups who had gotten stents and bypass surgeries. So despite proven science, unfortunately, doctors and patients are slow to adopt diet changes. However, I'm hoping as more of us are becoming aware of benefits of plant-based diet, that will change. So here's a doctor who's actually recommending it. Yeah, some of you have already seen this slide. I love this one. So it says, so you have 2 choices. We can perform triple bypass surgery where we take a vein out of your thigh, open up your chest so we can sew the vein onto your coronary artery. It'll cost $100,000 and will keep you laid up for at least 2 months. Or we could put you on a vegan diet. And the patient's response is, a vegan diet? That sounds pretty extreme. And the funny thing is that adjective extreme is the one I often hear from my patients when I recommend a plant-based diet. So taking 15 pills a day is very common and not considered extreme. Having open heart surgeries is also common and not considered extreme. But changing our diet to treat and prevent disease is extreme. So a lot of times then I back off and we agree to maybe decrease meat from 3 times a day to twice a day. Or we agree to do meatless Mondays or some kind of improvement in our diet if plant-based diet is too extreme. Every once in a while, though, I do get a patient who is willing to try this extreme, completely plant-based diet. And in that case, I recommend 21-day kickstarts. There are plenty of them out there. You just have to Google 21-day vegan kickstart or plant-based kickstart. PCRM, Physicians Committee for Responsible Medicine, has one of its own. So I do recommend that they do that. Why 21 days? 21 days is about the amount of time it's needed to change our habits. To show us that we are not going to go hungry on a plant-based diet. However, often it's not enough time to see all the benefits. Some of my patients will feel better right away. However, I tell them they might not. There might be a little bit of a transition period. Our bodies are reluctant to change, even when change is for the better. So sometimes there are some GI symptoms, some skin changes. I personally actually had slight weight gain when I first became a vegan, but all of these are temporary. Soon you find a new homeostasis with your body, which is better than ever before. So fortunately, in 2 to 3 months, in everyone that I've seen, health gets objectively and subjectively better. Not just their symptoms, but their numbers actually improve. Their blood pressure numbers improve. Their cholesterol numbers are lower. Uric acid level is lower. I can actually get them off their gout medications. Blood sugar levels are lower. We can decrease the diabetes medicines. Liver function tests get down to where fatty liver actually resolves. So a lot of benefits from switching for switching from standard American diet or the SAD diet to a whole food plant-based diet. So we talked about cancer prevention, heart disease, diabetes, of course obesity. We haven't talked much about brain diseases, so I'm going to talk briefly about that. Dr. Bernard's book, Power Foods for the Brain, cites a lot of research showing link between diet and Alzheimer's disease. Also, in 2014 and 2015, several large studies consistently reported an association between milk intake and a higher incidence of Parkinson's disease. This was news to me, especially in males for some reason. So whole food plant-based diet adds years to your life, and I think more importantly, adds life to your years. So diet is very, very important, but it's not the whole story when it comes to wellness. I couldn't do this talk and not talk about exercise being an important aspect of achieving wellness. So when I was in medical school, almost 20 years ago, the recommendations were to exercise 3 times a week. Now they've been increased to 5 to 6 times a week. I tell my patients to just make exercise a habit and do it every day. Our motto is exercise only on the days that you eat. So, a lot of people ask me what's the best kind of exercise. And the answer is always the right kind of exercise for you is the one that you will do regularly, that you will stick with, that you will enjoy. We know that running increases the most endorphins, the feel-good hormones. We know that yoga decreases stress hormones the most. Yet, all of these types will do both things in some form. So, for your mental and your physical health, exercise just needs to be a part of your routine. Okay, here's another difference. So the patient's saying, doctor, I don't feel well and I'm not sure why. The doctor's saying, I want you to meditate for 20 minutes, twice a day, exercise for at least 30 minutes a day, avoid processed foods, eat plenty of organic fruits and veggies, spend more time in nature and less indoors, stop worrying about things you can't control, ditch your TV, come back in 3 weeks.
Wow.
My younger son, who helped me make these slides, because I needed help with technology, he commented on this one. He said, Mom, if you say this, your patients will never come back. And he is absolutely right. So I don't say this, not all at once at least. But I do try to sneak in parts of this at appropriate times. Also, this slide is showing the doctor not listening to the patient and jumping to give recommendations. I found that if I don't listen to my patients, they don't listen to me. So first part, of course, has to be listen to what's going on and why he's not feeling well. Maybe the poor guy just had the flu and started giving all these recommendations. But I do agree with this doctor about his first advice as well, in that our attempts to achieve wellness would not be complete without making time for mindfulness and meditation in our day. Fortunately, meditation is making its way from hippie culture to yuppie culture to mainstream culture. Many patients are already familiar with meditation and even its health benefits. So my job often is to just remind them and encourage them. We'll talk about one of those health benefits of meditation. So most of you probably heard of somebody healthy having a heart attack or having heart disease. And by healthy, I mean they don't have the traditional cardiac risk factors, which are smoking, diabetes, high blood pressure, family history, sedentary lifestyle. And yet they have a heart attack. It's because of how their body is handling the stress hormones. Stress hormones do cause our blood pressure and heart rate to rise, causes our arteries to constrict, should get narrow, including our cardiac arteries, to where 30% blockage, which we usually consider insignificant, can all of a sudden become significant if the artery is constricted. Cortisol, one of the main stress hormones, adds to inflammation in the heart and plaque formation. Adrenaline, another stress hormone, makes platelets stickier to where more blockage can stick to the walls of the arteries. We know that stress-reducing activities do decrease levels of stress hormones, and they do cause coronary arteries to relax. So all of that then decreases our chance for heart attacks and strokes. So just sitting for 10 to 20 minutes a day can really improve both physical and mental health. New studies show that meditation can even physically change the structure of the brain and form new connections in the brain that can handle stress better. So for people who may have dozed off, I made this last slide to sum up my presentation in 90 seconds. No tobacco in any form. I didn't spend much time on that because media has done a great job telling people about smoking and its risks. I wish they would do that kind of a job with meat and dairy and their risks. Eat variety of plant foods, variety of colors, 40 grams of fiber in your day, avoid animal products and oils. Eat real food. Look at the ingredients. If it's saying it has chemicals that you can't pronounce, put it back. There will be something else similar to it that doesn't have those artificial ingredients. Minimize alcohol intake, regular physical activity, maintain your weight near your ideal level, and meditate. I know a lot of times 24 hours a day doesn't seem enough because we have so much to do, but taking just 15 minutes to spend with yourself in silence is really worth it for your wellness. And also, meditation will help you relax and rest your mind. Sleep is needed to help relax your body as well. So these are some of my sources for the information in this presentation. The new plant-based physician's guide, this was really exciting because this just came out this summer, and it's a guide for doctors on how to be plant-based doctors and how to talk to their patients about benefits of plant-based diet. And I actually bought some copies of it, and they're up here. If you'd like to take it to your doctor, that would be wonderful, because then we can get more people like me aware who can then make their patients aware. Also, I brought cancer prevention pamphlets that PCRM, Physicians Committee for Responsible Medicine, prints, and those are there, and also some copies of Plantrition Project pamphlets. So feel free to take what you want for yourself or a veg-curious friend and share it with them. So I hope I've motivated you to eat well, move well, and rest well so you can stay well. Thank you for your time, and I wish you all happy and healthy lives. We can do Q&A.
We'll do some Q&A, so if you have any questions, we can go ahead.
I have a question. So, for someone who's a novice to meditation, what are your recommendations to start?
Okay, so that article that I showed in Time Magazine on Mindful Revolution, it has a little rectangle where it tells you how to do 5 steps to mindful meditation. So I usually just give my patients that because it's very, very secular. There is quite a bit out there. I personally, I went to a 10-day Vipassana course. And that was a life-changing experience for me. But not everybody has 10 days that they can take off. There's quite a bit online that you can probably find relating to starting with meditation. Christy?
Yeah, I know there are a couple apps that will like guide you through.
Oh, okay.
Especially if you're kind of like, what am I supposed to sit here and think about or do? I know there are a couple like Headspace or something, and a couple others, and they guide you through different topics.
Okay, yeah, that's great. Thank you.
Are read the other day that the average American has the TV turned on 8 hours a day,
Yeah.
and we're sitting in front of it 4 hours a day.
Yeah.
So when someone,
Background noise.
so when we say we don't have time to cook, we don't have time to exercise,
Right.
that has to be a lie,
That's right.
because they can prove they're watching TV, so it's something's haywire.
That's right.
Right. We just have to set our priorities straight.
Right, priorities.
Yeah. We have to, I had someone say, we have to accept our own friend request. Right? Accepting everybody else's, but we want to take 15 minutes in meditation to accept our own.
Yeah.
I don't get on Facebook.
Yes.
We hear that physicians don't get little or no training in nutrition.
Right.
Is that changing at all in medical schools?
I hope so. I know PCRM and Dr. Neil Bernard and those people are really working to make those changes, but changes are always slow to come. Yeah, we get like maybe 3 one-hour lectures during 4 years of medical school.
Wow.
Yeah, it's pretty sad. You had a question?
Yeah, do you have to eat more plant-based protein as compared to animal protein to get your recommended daily
Amount of protein? Actually, no. Protein deficiency is so rare, and it does not happen if you are not malnourished. If you're getting enough calories in a day, you're getting enough protein in a day. Actually, would refer you to Dr. Garth Davis, who was a speaker here in February.
Yeah.
His book, Proteinaholic, that really talks about how we are obsessed with protein in this culture, and it's really hurting our health. Even in terms of kidney function, when you eat more protein than you need, then your kidneys have to work harder to get rid of it in the urine, and that harms your kidneys over time as well. Along with, I mean, his book really goes into a lot of details. Really, the libraries have it. Harris County and District.
Any other questions? Oh, there's one in the back.
Oh, yes.
I wish I had dragged a few of my friends along this evening. Is your presentation online? Will you be speaking anytime soon?
Oh, that's so nice. No, but somebody is taping it, Snail here. So maybe you could get it from him. I was going to get it from him, too.
Can you put it up on YouTube?
Yeah.
We can also put it on our YouTube channel for Vegan Society P.E.A.C.E. Snail will hook us up with it, so yeah.
Oh, okay. All
We'll get
right.
it up.
Thank you, Snail. Okay, we'll give it back to Kristen.
Okay, all right. Let's give another warm. All right, thank you for that presentation. And just a disclaimer, we did not know that So Delicious was coming tonight for the sweets. Since our theme was health, we did not know this in advance. So I apologize, it's a decadent temptation over there, I know. All right, so we're towards the end of the program. We're going to celebrate birthdays and door prizes and some announcements. And who would like to come up and help me sing the birthday song? Because Anuj isn't here. I know you all. Christine's going to come up and sing. All right. I cannot sing, so.
Your vegan always gets muddled in the middle of the dressing crazy.
That's true. Okay, so for those of you that are new here, we always recognize birthdays each month. We have a little goodie box too. So who is having a September birthday?